Welcome to Healthy Perspectives from St. John River District Hospital. I'm your host, Brian Taylor, and today we're going to be talking about lung cancer, and more specifically about some of the screening tools that are available to diagnose this deadly disease. Our guest today is Dr. Edward Mauch, a diagnostic radiologist from St. John River District Hospital. Thanks for being with us today.
Thank you, Brian, for having me.
Let's get to the basics so people can get an understanding of what this disease is all about. Tell us what lung cancer is and kind of how it develops.
Sure. Well, lung cancer is one of the top 5 cancers per numbers that we encounter in medicine. What makes lung cancer a little more challenging or more scary is it is the number one mortality of the cancers we see in medicine. In fact, if you sum up the next 4, including breast, colon, prostate, combined, there's more deaths from lung cancer than the next 4 combined. So it's very dangerous cancer that right now is a challenge in medicine.
Now, unlike some other cancers and I know lung cancer can be environmental, but the primary cause of lung cancer is smoking, isn't it?
Yeah, the primary cause is smoking. Smoking is they associate roughly 80 to 90% of lung cancers and it significantly increases your risk. The number one way to decrease your risk for lung cancer would be smoking cessation, and that's why I'm sure a lot of people that are smokers are sick of hearing their physicians harp on them, but it's the best way to go about it.
So this is one of the, at least to that extent, this is one of the cancers that you can control.
You can control to a certain extent. Obviously, like I said, there's 10 to 15%. There's secondhand smoke. There's other factors, like you said. The number 2 factor is radon, which we can't control. It's in the earth below us. We're exposed every day. There's cosmic radiation. When you fly in a plane, you get a little bit more radiation than someone who doesn't fly in a plane. So if you make a overseas flight, it's another exposure. But by far, the biggest risk factor is smoking.
Now, we've talked about it being one of the top killers, and I don't think a lot of people realize that because we hear more about breast cancer and things like that. This disease is really hard to diagnose, though, isn't it?
Yes. I mean, you can see all over on TV and all over newspaper ads and everything else. Breast cancer, there's ways to go about it. Women self-examine their breasts every month. You get an annual physical exam, a physician exam, breast exam. You can, and beginning at 40, women are encouraged to get annual mammograms. That's how we, kind of stay on top of breast cancer, prostate. Men get digital rectal exam by their physician. Their physician can keep track of their PSA. There's screening modality of that. Colon cancer, we encourage colonoscopy beginning at age 40, and that gets done every 3 to 5 years. Currently, was nothing in place for lung cancer, and still there is nothing that's insurance improved. But there was a very positive research trial that gone on the last 15 years, and hopefully it will be covered by insurance relatively soon, and we're on that track.
Well, we'll come back and talk about that in just a second. We're going to take a quick break. You're watching Healthy Perspectives from St. John River District Hospital. Welcome back to Healthy Perspectives with St. John River District Hospital. Our guest today is Dr. Edward Mauch, who is a diagnostic radiologist at St. John River District Hospital. And today we're talking about lung cancer and diagnostic ways to identify the disease and treat it. And we were talking about the difficulty in diagnosing this disease before we went to the break. What makes this disease so difficult to diagnose?
The biggest thing is the disease basically starts out as an abnormal growth in your lungs, and we call them pulmonary nodules. Basically, these nodules continue to grow and grow in your lungs, and most people won't have any symptoms from them. As they grow and grow, there's more potential that they can spread into the other lung or anywhere else in the body or into the lymph nodes of the lung. As they spread, the disease obviously becomes more progressive, poor prognosis, all things that lead to a poorer outcome for the patient.
Now, so it sounds like, unlike heart disease, you know, we know people have heart attacks, they have the elephant on the chest, you know, the pain, and that's not the case here. The symptoms sound like they come very late, and by the time someone realizes they may have lung cancer, it may be too late.
Yeah. Some of the symptoms, when eventually gets down the line, you know, generalized weakness, breathing issues, shortness of breath, chronic cough, can get spitting up blood or hemoptysis, the medical term for it. All symptoms that we look for. The problem with, as we said, there's a strong association with smoking, so generally these patients also have underlying emphysema, so it's hard to figure out what's related to the cancer and what's related to their baseline emphysema. So it's very hard to notice a significant change.
Now, there are different stages of lung cancer too, correct?
Yeah, there's multiple stages, and you know, when you get staged, it's usually based on how big the primary lesion is, and then if you have lymph node involvement or if you have distal lesions. The staging affects basically your 5-year prognosis or your long-term prognosis.
Now, we've talked about how difficult it is to diagnose, but you mentioned before the break that there's been some research about a particular diagnostic tool called the low-dose CT screening. Tell us, first of all, what that is exactly.
Sure. I'll start with the research. Was the National Lung Screening Trial started about 15-20 years ago. Used multiple centers from around the country, and they randomized people into certain categories, and they wanted to see, well, could we just use a normal chest x-ray? Clinician, you know, he comes to your doctor, he says you're a smoker, oh, I'll just get a 2-view chest x-ray. If there's nothing there, you don't have cancer. And what they did was they randomized people into one group that got chest x-rays every year for 2 years, and they randomized people that got this a low-dose CAT scan for 2 years. They found dramatic difference in what was picked up. The chest x-ray only picked up about 6% of cancers each of the 3 years in that ballpark. The CAT scan was more, the CT scan or CAT scan, we call it, was more in the 20 to 25%. So you can see there was a significant difference, and they immediately you know, were stunned by statistic how much difference there was. Published multiple papers, and now it's becoming widespread that low-dose CAT scan is, for a high-risk patient, this is the way to go. This will be probably the next, like we said, the next screening study. The low-dose CAT scan, it's very easy to do. There's no IV. We don't give any IV contrast. A typical CAT scan, we run at higher parameters. We do it a little bit lower because we're just looking for those nodules, the beginning signs of cancer. And so the patient is exposed to about 20% of the radiation of a typical chest CAT scan. It's measured in a unit called millisieverts, and they average about 1.5 for a low-dose CAT scan. And just to give you a background or what that number really means, every year you're exposed to about 3 millisieverts of radiation per year. So it increases, it's about 50% of what your radiation you're exposed to the whole year.
So this is the average person. This would be what they're used to seeing. That you get in the tube and you go in for the CT scan.
Yep, it would take you know, the whole scan to run probably take less. The whole scan to run take less than 30 seconds. Probably a whole prep to get you on the table. You just lay on your back. We run a scout and then designate the lung fields, and the technologist runs you through once, and you're all done. Whole procedure is probably done less than 5 minutes.
Now, this is designed for people who are at who are at higher risk for lung cancer.
Higher risk.
And that those kinds of people are who?
So the people we were targeting would be basically smokers. The criteria that they found through the study that they found the highest risk would people that have we call 30 pack years of smoking history. 30 pack years basically means I've smoked a pack a year for 30 years, or I smoke a pack a day for 30 years, or I smoke 2 packs a day for 15 years, or 3 packs a day for 10 years. That's sort of equivalent. And it targeted, it's most beneficial for patients between ages 55 and 75. That's what the study just showed, that they've been smoking this long, and starting at age 55, this was the cutoff. There was another group that they may be able to get through, is persons age greater than 50 who have 20 pack years, who also have another significant risk factor, whether they worked in a area where they were exposed to environmental thing like asbestos, or they have a strong family history of lung disease. Those patients are also would meet the people we would want to get on board with this screening CAT scan.
Now, how big of a breakthrough is this for those type of people who know they're at high risk for lung cancer, but really there wasn't a tool before to see where they stood?
It's dramatic breakthrough, and that's what the national lung screening trials showed. Like I said before, your doctor may have thought, well, they did sputum cultures where you spit in the cup and they look for malignant cells. They did 2-view chest X-rays. None of this has proven to improve the mortality from the lung cancer. The screening trial run through the national centers, or run through centers all around the country, found a 20% mortality decrease by doing this study and getting these patients treatment earlier than if they had waited to get symptoms like we had talked about before.
Now, so do you see this as essentially becoming a standard of care? Is it already there?
It's right now, if you're in that risk, those groups we were talking about, this is the standard of care. It's coming. It will be the next screening study. Your doctor is going to harp on you to get your colonoscopy at 40. If you fall into this category, I'm 55 and I've smoked 30 pack years, it will be the next one the insurance will have to approve. Until it gets approved, we highly encourage it at patients come, and that's why we're offering it at a markedly decreased rate. We want to get these patients in and hopefully tell them they're okay, or get them on the path to getting their cancer treated before it becomes too late.
Our guest today is Dr. Edward Mauch, a diagnostic radiologist from St. John River District Hospital. We're talking about lung cancer and lung cancer screening. We're going to take a quick break and come back and talk a little bit more, then wrap things up on Healthy Perspectives from St. John River District Hospital. Welcome back to Healthy Perspectives. I'm Brian Taylor, your host, and today we're talking about lung cancer screening with Dr. Edward Mauch, a diagnostic radiologist from St. John River District Hospital. And we've talked a lot about the screening, a lot about what this means for patients. As a physician, you're the one in the in the room who's looking at the scans. What does this mean what's your take-home message for these patients who are going to get these scans and who need these scans?
Yeah, my take-home message is, if you fall in that high risk, this is, I encourage you strongly to do this. Like, we can clearly see if there's lung nodules. The CAT scan is an unbelievable thing. It basically takes an internal picture of your body. Based on what we find on that, it could lead you. If it's negative, obviously you're fine. If we find the nodule, depending on the size, leads you down different pathways, like all the pulmonologists and oncologists will tell you, the earlier you catch a cancer, the better. If you unfortunately fall in the later stages, the stage 3B or 4 we call them, you have less than 5% chance for a 5-year lifespan. So the whole point is trying to get them in the earlier stages, the 1, 2, the 3A stages that we use to stage the lung cancer.
Prior to the CT scan, or at least the results of this study that showed how effective the scan was, I'm guessing a lot of people who didn't know they had cancer, and once they were diagnosed didn't have hope. This is going to give people a little bit of hope who maybe weren't going to have their cancer caught, right?
Yeah. Like I said before, the whole point is trying to get the patients to catch the cancer earlier, and screening someone before they have symptoms is the best way to do it. It's tragedy when we see someone, come through the ER and have an abnormal chest X-ray, and then, have this wide-blown cancer, or it's invading their mediastinum or something, somewhere where we know it's going to be a poor prognosis, or, essentially incurable, or where you're trying to do palliative care. This study you run through the CAT scan machine. We look for those nodules. Based on the size of the nodules, it will determine should we do follow-up, should we do biopsy or PET exam at that time. It'll basically get you on the right pathway to go. If you're clear, you're clear. We can safely say, it looks good, and you're good for now.
You mentioned how difficult this is for physicians. Somebody comes in with that chest X-ray, it's abnormal, and the diagnosis is lung cancer. Now, what's it like from a physician's perspective to know that you have another tool in your toolbox, so to speak, to help you? Maybe you can't prevent the cancer, but you can certainly catch it early and help treat somebody.
Yeah, and it's very exciting. As a clinician, we obviously, the technology we have now, you want to prolong as many lives as you can and have quality years. And we catch a nodule at a small enough size before it has spread. There's many ways to treat it nowadays. You can take out just that part of the lung. You can, some people do different ways to get that nodule attacked. It's exciting that we can get it before it spreads or gets too big and leads to more mortality or morbidity for the patient.
Well, I appreciate coming in today, doctor, and talking about lung cancer and talking about this important screening tool that's available for patients. And speaking of the screening tool, St. John Providence Health System offers the low-dose CT screening. It's $99. It's a tremendous bargain, and it can save a life. Go to our website, www.stjohn.org, and you'll be able to find more information about it, or you can call us at 866-501-DOCS. That's 866-501-DOCS. Thanks again for watching today. This is Healthy Perspectives. Stay tuned to our station here, and hopefully we'll have more episodes that you'll enjoy coming up in the future. For now, I'm Brian Taylor from River District Hospital. Have a good day.